Have you been noticing more hair in your shower drain? Your hairline climbing up your forehead? Your part is starting to get even wider? These are some typical signs of hair loss. And you're not alone. And you're not crazy for wanting real answers that actually work. This is an issue many patients are facing and are eager for answers and solutions. In this video, we're going to break down the real causes of hair loss, some of which might surprise you, what most people misunderstand about their hair growth cycle, the emotional toll this takes, and why it's valid, and finally, real science-backed strategies that can help you protect or even regrow your hair. And make sure to stay with me until the very end, because the most important thing you can do for your hair health is something almost nobody talks about. Let's get into it. Before we talk about hair loss, we have to understand hair growth. Hair experiences phases of growth, fallout, and then regrowth. Your scalp has around 100,000 hair follicles, and each one goes through a life cycle of growth, rest, and shedding. First is the anagen phase. This is the active growth phase. It lasts 2 to 7 years. About 85% to 90% of your hairs are in this phase at any given time. Then there's the catagen phase, a short transitional phase lasting 2 to 3 weeks, where growth stops and the follicle shrinks. Then you have the telogen phase. This is the resting phase. About 10 to 15% of your hair is here. After a few months, the hair falls out. Then we have the exogen phase. This is the actual shedding of the hair shaft itself. If this cycle is disrupted, say, too many hairs shift into the telogen phase, you'll start seeing shedding, thinning, or even bald spots. This disruption can be caused by hormones, illness, medications, stress, or genetics. Let's talk about the most common forms of hair loss and what causes them. Androgenetic alopecia. This is male and female pattern baldness. This is the most common cause of hair loss, and it's genetically driven. In men, it often starts with a receding hairline or bald spot at the crown. In women, it shows up as diffuse thinning along the part line. It's linked to a hormone called dihydrotestosterone, DHT. This is a byproduct of testosterone that shrinks hair follicles over time. Then we have telogen effluvium. This is temporary hair loss triggered by stress illness, like, for example, COVID-19, childbirth, crash diets, or various medications. This is one of the most common yet misunderstood causes of sudden hair shedding. It occurs when a large number of follicles enter the telogen phase prematurely. This is often due to a stressor like illness, major surgery, emotional trauma, childbirth, or again, crash dieting. What you need to know is this: telogen effluvium is not permanent hair loss. It's a temporary disruption of the normal cycle. While it can cause significant shedding, sometimes handfuls at a time, the follicles aren't damaged. In most cases, hair regrows naturally within 3 to 6 months once the underlying cause is addressed. So if you've noticed sudden shedding a few months after a stressful event, don't panic. This is often reversible. You're not going bald. Your body is simply resetting under these circumstances. Now let's talk about alopecia areata. This is an autoimmune condition where your immune system attacks the hair follicles. It causes patchy bald spots and can progress unpredictably. Then there's traction alopecia. I see this all the time. I see it in my practice all the time, and I try to educate and warn people against this. This happens when people wear tight hairstyles like braids or ponytails or extensions, or they put chronic tension on the follicles with tight headbands and different hair devices that are meant to hold the hair back or in place, but it leads to damage and eventual hair loss. So you have to be very, very careful about that. And remember, hair isn't just about appearance. It's tied to our identity, our confidence, even our sense of youth and vitality. That's why hair loss can lead to social anxiety, lower self-esteem, depression or emotional withdrawal. And for many, these feelings are dismissed even by doctors. But these are very real feelings. So if you're struggling emotionally with your hair loss, know this: it's valid. You're not being vain. You're not being a child. You're not being unreasonable. You're being a human being. Our hair can be tied to all kinds of feelings of identity, confidence, and attractiveness. Losing it can shake that. I encourage you to talk to a doctor who takes it seriously, because how you feel matters. You may have to see a specialist about this. Since hair loss is such a hot topic, naturally, a lot of claims and misinformation spreads easily. Let's clear up some common hair loss myths. Myth number 1: shampooing too often causes hair loss. The fact is, shampoo does not cause hair loss, but harsh formulas or overwashing can dry out the scalp and the hair shaft. Myth number 2, wearing hats makes you go bald. The fact is, hats don't cause hair loss, unless they're extremely tight and cause traction. Myth number 3, hair loss comes only from your mother's side of the family. Don't blame poor old mom. The fact is that hair loss can be inherited from your mother or your father. Myth number 4, supplements can regrow hair overnight. The fact is, no pill or powder works instantly, but some nutrients do play a role in healthy follicles, which we'll get into shortly. Myth number 5 is that creatine causes hair loss. The fact is, this one's still debated. A single 2009 study found that creatine supplementation may increase DHT levels, the hormone linked to male pattern hair loss, but larger high-quality studies haven't confirmed this consistently. If you're genetically predisposed to androgenetic alopecia and you're using creatine, it may be worth discussing with your doctor or even a dermatologist. But for most people, there's no strong evidence that the creatine directly causes hair loss. Here's where we separate hype from help. These are the strategies with real evidence behind them. First, let's talk about topical minoxidil, also known as Rogaine. This was originally a blood pressure drug, and it was found to grow hair in some patients. It improves blood flow to the hair follicle, and this may prolong the anagen or growth phase. It works for many people, especially with early stage androgenetic alopecia. So the earlier you take action, the better. Minoxidil can be used topically. Think of brands like Rogaine once again, and in more serious cases, minoxidil can be prescribed internally for hair growth. Please know that if you're pregnant, do not use minoxidil as it is not approved. Please consult your doctor before using any new medication internally or topically. Now let's talk about Finasteride. You've probably heard of it as Alopecia. This is a prescription drug and it blocks the enzyme that converts testosterone to DHT. And it can slow or even reverse male pattern hair loss. It's oral and not recommended for women of childbearing age. Next is low-level laser therapy, LLLT. These red light devices stimulate mitochondrial activity in follicles and increase circulation. Some clinical trials have shown modest but real results. Now let's talk about PRP, platelet-rich plasma. PRP has grown in popularity over the last 10 years or more for hair loss. PRP involves drawing a small amount of your own blood, spinning it down in a centrifuge to isolate platelet-rich plasma, and injecting that plasma back into the thinning areas of your own scalp. The idea is that these platelets release growth factors that may help stimulate hair follicle activity and extend the hair's growth, the anagen phase. While early studies and clinical experience suggest PRP might improve hair thickness and slow shedding in some people with androgenetic alopecia, results vary and larger, high-quality studies are still needed. Remember, this is not going to grow hair, and nothing will, where there is no hair and there is no follicle. Bald areas where there are no follicles will remain bald. It seems promising, but it's not a fully proven treatment. It's generally safe since it uses your own blood, but it's also costly, not covered by insurance, and isn't guaranteed to work. Think of PRP as maybe, potentially helpful, as a part of a combination plan, but certainly not a silver bullet and not a magic trick. Next, let's talk about nutritional support. Hair is made of protein, specifically keratin, but there's much more needed to sustain healthy hair growth. But your follicles also depend on iron. Low levels cause telogen effluvium, zinc, biotin, vitamin D, omega-3s. If your diet is low in these, or if you've had a recent illness, supplementation may help. A blood test can help determine what you're missing. You don't have to wait for your hair loss to be severe to act. In fact, don't. If it's important to you, act early. There can be steps taken early, in the early stages, to possibly prevent prolonged hair loss. Here's how to protect what you have. Don't ignore early signs like widening of your part or excessive shedding. Avoid tight hairstyles and harsh chemical treatments. Eat a nutrient-rich diet with healthy fats, lean protein, and colorful vegetables. Address stress. High cortisol levels affect hair cycles. Consider a regular scalp massage. It improves blood flow. Sleep. We talk about sleep in my program all the time. Your follicles recover at night. Don't shortchange them. And now, for the most overlooked but essential piece of advice. Get a professional diagnosis. Hair loss can be a warning sign of other bigger issues or health conditions. Hair loss can be a symptom of thyroid disease, autoimmune disorders, anemia, nutritional deficiencies, polycystic ovarian syndrome, PCOS, chronic stress, or trauma. So before you spend thousands of dollars on shampoos or gadgets, see a dermatologist or medical professional who can identify the root cause. You see what I did there? Hair loss isn't just a vanity issue. It's a health issue. And like any other health issue, the earlier you act, the more options you'll have. You know, in my practice, believe it or not, although I'm a cardiovascular surgeon specializing in people with venous and lymphatic problems, for a number of years, a very dear friend of mine who I had trained with in general surgery had gone on to become a plastic surgeon. And because he knew that I had a large number of women in my practice and even men who were interested in their overall general appearance, he asked if he could come and use some space in my office for a number of years. And he did. And it worked out very well. One of the things that he brought into the practice was, believe it or not, hair transplantation. And at that time, I learned a lot about this subject, and it was a fascinating subject. And I watched him do many cases with beautiful results. And one of the things that we should talk about is hair transplantation, because I must tell you that modern day hair transplants are absolutely imperceptible. You can see a bad hair transplant, but trust me when I tell you, you cannot tell if somebody's had a really good, modern, contemporary hair transplant. That's a subject we can get deeper into one day. But I have to tell you, we saw patients change dramatically in terms of their happiness, their mood, their self-confidence, their feeling of personal attractiveness, and it was a wonderful thing to witness. My friend is no longer, here working with me, so we don't do that anymore. But for probably 7 or 8 years, we did. And it was very, very gratifying to watch many of these patients who were my patients for vascular issues, venous issues, who underwent hair transplantation, really light up and come back to life in many ways in terms of their self-confidence and their personality. So I have a great respect for this field of medicine. And there are many dermatologists and surgical hair transplant specialists that I think that you should see if this is something that's important to you. Look, if you feel that this video helped you and made you feel more informed and more empowered, please share it with somebody you think might feel the same way, somebody who might be going through the same thing. And do me a favor, drop a comment if you've had any experience with any of the treatments we've discussed, or if you have questions. I'll try to answer as many as I can. I do try to look at every single comment. I'm Dr. John Chuback, and I thank you for watching. Please stay healthy, inside and out. See you in the next video.